Nursing NCLEX RN Review Video, Medical Legal Terminology. In this section, we focus on medical legal terminology that is relevant for the NCLEX. There are certain decision-making skills and some terms that you just need to remember. And although it may not build into that critical thinking philosophy, it is high enough yield that it is important for you to know. Before I begin, be sure to check out the links in the description box for various free NCLEX content and subscribe as I upload at least one new nursing video every single week. Ethical principles. You need to remember these terms and be able to effectively apply them in certain situations. Therefore, it is not okay to just simply memorize the terms. You need to understand them and be able to identify which situations are a breach of these ethical principles. First one, autonomy, to act based on one's professional knowledge. Number two, beneficence, duty to do good for others. Nonmaleficence, obligation to do no harm to others. Justice, fairness, must be fair when treating care to patients and for others. Veracity, obligation to tell the truth. And fidelity, obligation to do as one's promised. Here are some practice questions that'll help enforce what I just said. Number one, when designing a plan for pain management for a post-operative patient, the nurse assesses that the patient's priority is to be as free of pain as possible. The nurse and the patient work together to identify a plan to manage the pain. The nurse continually reviews the plan with the patient to ensure that the patient's priority is met. Which principle is used to encourage the nurse to monitor the patient's response to the pain? Number one, fidelity. Number two, beneficence. Number three, non-maleficence. And four, respect for autonomy. Number two, a child's immunization may cause discomfort during administration, but the benefits of protection from disease, both for the individual and society, outweigh the temporary discomforts. Which principle is involved in this situation? Number one, fidelity. Number two, beneficence. Number three, non-maleficence. And number four, respect for autonomy. Number three, fill in the blank. The point of the ethical practice is an agreement to reassure the public that in all ways the healthcare team not only works to heal patients, but agrees to do this in the least painful and harmful way possible. This principle is commonly called the principle of blank. The answers for the questions are, number one, the answer is fidelity. Number two, the answer is beneficence. And number three, the answer is non-maleficence. Before I go on to speaking about the principles of patient confidentiality, I would appreciate it if you would rate this video. These videos take a long time to make, and if you would like to see more of these videos, please give me feedback by either giving it a thumbs up or a thumbs down. This will help me decide whether I should make more videos like this in the future. Thank you. Principles of patient confidentiality. So do not discuss client issues with other clients or staff not involved with patient's care. Not sharing healthcare information without the client's consent. Keeping all information about the patient private and not revealing it to someone not directly involved in care. Discussing patient information only in private and secluded areas. Protecting medical records from all unauthorized readers. Advanced directives. There are two types of advanced directives. Living wills is one of them. This lists of medical treatment that a client chooses to omit or refuse if the client becomes unable to make decisions. Think of this as the patient's code status that is made by them. Number two, durable powers of attorney. A person chosen by the patient to make healthcare decisions. Other important legal facts are, nurses need to report these incidents. Number one, client falls. Number two, medication errors. Number three, needle stick injuries. Number four, procedure or equipment incidences. Number five, visit injury that occurred on healthcare premises. Visitors. Number six, visitors that have symptoms of communicable diseases, and number 7, criminal activities such as elder abuse, domestic violence, animal bites, gunshots, stab wounds, assaults, and suicides. That's going to be the end of this video. If you found it helpful, please leave a thumbs up and let me know in the comments below if you'd like to see more videos like this or if you have any critiques to any of the videos I've created. Also, be sure to subscribe as I do upload a new video every single week, and here's how you can check out my website. Thanks for watching, and I'll see you in the next video. Hey guys, just thought I would show you how to get to my website. All you got to do is go to Google and search Simple Fit Nurse, or you can go to your web browser and search www.simplefitnurse.com. In my website, I have free ebooks that I've created. I have a free fitness guide, I have a free NCLEX guide, and I have a free nutrition guide that I've created, and it's all free. You can click on the appropriate tabs at the top of my website and you get access to them. I do post blog posts every single week with my videos, and they're helpful if you want to take a look at graphs and diagrams that come along with that. I also have a NCLEX review session where I post all my NCLEX content, so be sure to check those out. Also, if you're interested, check out these videos and be sure to subscribe for more content every single week. Thank you for watching, and thank you for making it till the very, very end. I appreciate it. See you next time.